microphones muted and your cameras off to help with the connectivity. If you wish to speak, then raise your hand. You're going to be promoted to the panel, and then I will ask you to come forward, and then please unmute your microphone and also put your camera on so we can all see you. So without further ado, I would like to give the floor to Hendrik from the GAP Secretariat to tell us a few things about the GAP. Hendrik, the floor is yours.
Thank you very much, Myria, and welcome to everyone on this webinar, which is coming at extremely timely. As Myria mentioned, we launched the progress report about a month ago and clearly highlighted there also the need to strengthen the engagement with civil society. And this is a great opportunity. It also builds on a exchange the WHO Director General had last week in a town hall he's doing with civil society organizations where the Global Action Plan came up, both with a link to social accountability and participation mechanisms, and also with a short discussion on the way forward for the civil society engagement accelerator. So thank you very much to the organizers from Watch the Gap, Medicus, Mundi, Thomas, and Myria from Wemos, COPASAH, and the Civil Society Advisory Group, which was also represented at the launch of the progress report with Justin Kuhnen, where he also, in sort of reacting to the presentation, I outlined already that, of course, it's using this this metaphor from the marriage, which we heard already when we launched the plan, that it's 12 agencies which got married, and then they forgot to send a postcard back from their honeymoon, from their extended honeymoon, which was the last year. So it's really a great opportunity to engage with you all today as part of a strengthened engagement over the coming months and years. I will give you a brief overview about the Global Action Plan, how it came about, the setup, the commitments made by the agencies, but also let me start with the objective, the goal of this collaboration. And this is really to accelerate progress towards the health-related SDGs, leaving no one behind, including in the context of country efforts to recover and rebuild from COVID-19 through a partnership of 12 multilateral agencies. You're all aware, of course, the commitment made to the SDGs was made by countries, by governments, and it's countries achieving the SDGs, but of course the multilateral organizations which are coming together in this GAP effort, and I will go to them in a minute, have a central role to play. And of course, on the overall context also, we started the Global Action Plan a year ago in a different era, in an era where we hadn't seen COVID come into the world and the pandemic really putting a lot of pressure on all the achievement of the SDGs, highlighting inequalities around the globe. But let me first provide you a bit of the context about the Global Action Plan. As I mentioned, the Global Action Plan, and different than maybe some of the other WHO Global Action Plans you might have seen, it unites and commits 12 multilateral health, development, and humanitarian agencies. And you see the logos small on the screen, but let me just name them also. It's Gavi, it's the Global Financing Facility, the Global Fund, UNAIDS, UNDP, UNFPA, UNICEF, UNITAID, UN Women, the World Bank, World Food Programme, and WHO. And WHO also hosts the Secretariat, where I'm from, and Isadora on the call, and Peter Singer is the senior lead in WHO, who's also has joined the call. And under the plan, the agencies are committing to better align their their ways of working and to provide better support to countries in the achievement of the SDGs. And the plan builds, it's not meant to create something completely new, but really to build on existing successful collaborations, which we have seen emerge over the last years, but provide an overall platform to bring many of them together. And overall, these agencies channel about 1/3 of development assistance for health annually, which shows it's an important group of organizations, but also clearly we recognize that it's only one group, and there are very important other players, of course, active in support of countries and at the country level. Next slide, please. As I mentioned, the progress report was launched a year ago in an event between the UHC high-level meeting, where countries committed to the UHC agenda and the health-related goals, and the first SDG summit, which the UN organized to review progress against the SDGs 5 years or 4 years since the launch of the 2030 agenda. And it really was designed to support countries as part of a decade of action on the SDGs. So it's really designed to be a 10-year effort over this decade, which, in addition to being a decade of action on the SDGs, is increasingly also becoming a decade of recovery, where we need to, in a way, redouble our efforts as countries, as the rate of progress we see is not fast enough to take us to the goals in 2030, but as many countries are also slipping back on some of the achievements over the last years due to the COVID pandemic. And the Global Action Plan comes with 4 key commitments of these 12 agencies: to engage, to work with countries, to identify priorities and plan and implement together, to accelerate by working together in specific areas, and I'll get to these 7 accelerators in a minute, and through that joint work also to align how the organization operate and design their financial and implement their financial strategies and policies, and account together. And we'll get in the second part of this presentation to the progress report, which is of course a key element of this accountability, shared accountability. Next slide, and that's all on the organizational institutional setup. We have 7 accelerator themes. I won't go into them in detail. You probably have seen them, but 2 of the following seminars, one will focus on primary healthcare, one on sustainable financing for health. Today we'll have a session also looking at the community and civil society engagement, and Roy Small will say a few words on the determinants of health work, and also how we're thinking of bringing these different accelerators together to provide better support and really respond to observations from the COVID pandemic, sort of on this important need to address the inequalities throughout the agenda. And then there's a cross-cutting commitment to gender equality. We have a separate gender equality working group, but it's very much also meant to be addressed through each of these accelerators in all country engagements. And with that, to the next slide. On the operating model, and this can be found also with more explanation on the website of the Global Action Plan. That's basically how we sort of wanted to showcase how the different elements are coming together, and so people can understand also sort of the different levels of agency involved. You see in the upper left corner, of course, the country demand, and I think with the important clarification notion, it's government, but it's also civil society, private sector, it's players at the country level. And this country demand, we want to respond through the Global Action Plan, and also in conversation with the with these players at country level. And the key role here is played by the country-facing teams, which are often the country offices of the organizations, but also you might have seen not all agencies there have a country presence, so it's the country focal points from those and bringing these together. Then we have the GAP Accelerator working groups, which are basically global working groups with the idea of driving forward the engagement on the accelerators and providing support to the country teams with a focus on these thematic areas. The GAP Sherpa group is the overall coordination group of the effort. All the 12 agencies are represented there. And then the highest level of governance, if you want to call it that, is the GAP Principles Group, chaired by the WHO Director General, which has met now in July, in September, and has 2 more meetings scheduled for this year to really provide this overall governance strategic direction. And then the small Secretariat, which I mentioned before, sort of to help facilitate these efforts. And yeah, going to the next slide. On successes, and I just wanted to take you back there also to the report which we launched, the GAP document. So the 3 key things we highlight there is a better coordination among the agencies in their global, regional, and in-country processes, a reduced burden on countries as a result of better aligned operational and financial policies and approaches, and a focus on purpose-driven collaboration integrated into the organizational cultures of the organization. And I think that's an important point to stress. So it's all focused on sort of getting the organizations work better together, but of course always with the big aim, and that's why the report is called Stronger Collaboration, Better Health, to achieve better health outcomes in countries and support countries achieving those. So where we recognize that the processes are all important, the collaboration piece, it's about impact at country level, helping to improve the lives of people. And on that, just a few reflections sort of at the end of the first year, and then Isadora will present on the progress report. Really, the first year has been a quite challenging year. You all know it sort of on the overall context, of course, global health with the COVID pandemic, but also linked to this last point on changing the ways of working of the organization. And the Global Action Plan is not a funding mechanism. So it's not that there's a lot of money coming and you just distribute it. It's really working through the institutional arrangements, the incentive structures in the organization to change the way they operate and support countries in achieving the health-related SDGs. And that takes time, and probably on some of the things we would have hoped to be a bit further. But with the COVID dynamic, of course, a lot of focus has been on that, and we're working in a way back to connect this COVID agenda with the SDG agenda, because the SDGs are still there to be achieved. And of course, we hear from many of the countries and see in the data that it's getting more and more difficult. So the effort is also more important than ever. And really, the Global Action Plan is meant to help optimize the system so we get better results out of what we have. There's no additional big funding, as I mentioned, but really optimizing how we all collaborate and support countries on their journeys towards the SDGs. And of course, for this, it's all in support of country leadership, and civil society can play a very important role in a way creating this demand, outlining what the needs are at country level, working with governments, working with the organizations to get it right and get the right approaches. Thank you.
Thank you, Hendrik, for this introduction. So I think now our participants who maybe were not so familiar with the GAP already have an idea of how it was conceptualized and developed and what it really represents. And I'm happy that you finished with the role of civil society, because that brings us very nicely to our next panelist, Thomas Schwarz from MMI and also from the Watch the Gap task group of the Kampala Initiative. And I would like to ask him to share from his perspective what was the role of civil society in this first part of development of the GAP and how we see it as civil society from a more critical perspective. So Thomas, the floor is yours.
Yes, please. Can you go ahead? Yes. So what I share is mainly an initial assessment of this action plan as produced in a small group of co-authors. You see the names on the screen. The whole team is in the call today, so I invite my colleagues to complement later, mainly during the dialogue session, if you like. You also see that, well, this is in a way the current state of this Watch the Gap task group. So we are not many, we are a small team, and there is still some additional capacity and brain power needed. So you are most welcome to share us in our work of critically watching this action plan and its implementation. Yeah, we started working on the analysis of the GAP way before it was published. And maybe you go to the next slide, Myria. So this is how our paper was structured. For us at the beginning, there was really the question: what is this action plan? One more global action plan. We had so many papers. What is the particularity of this new one, and why should we watch it? Could you please go ahead? Yes, next slide, please. So we found some good reasons for ourselves, because you have seen in the introduction by Hendrik, it's quite a big number of big animals which come together for this action plan. So it's the big players in the field of aid. There is quite a bit of power there assembled in one spot. So we ask ourselves, does this action plan have the ingredients to be a kind of a normative guidance in the sense of aid effectiveness, to make their work better, but also to provide entry points for addressing shortcomings of what we have seen as difficult practices of particular signatory agencies? Or does it, on the other hand, rather have the elements for mainstreaming policies which we would not so much like to be mainstreamed, such as the promotion of public-private partnerships? Then we asked ourselves the relationship between the GAP and global health governance. Is there an added value, or where is it just positioned in this whole field? And we looked at also the issues related to governance of this GAP and its implementation, rules, responsibilities, transparency, etc. The main challenge is, however, at national level, and Hendrik already stated, the GAP works or does not work at a national level. And you see on the screen the list of challenges or questions we had regarding that national level. Is it really that those agencies better align their plans with what's there at the country level as plans, as policies, without creating parallel donor systems, as we have so often seen? How is it interrelated to existing country level mechanisms involving the same actors and already established? And again, what are the power dynamics around the global action plan? And how will it influence and impact on the power between those agencies, but also the power dynamics between those agencies and national governments and civil society? And particular eye, in fact, on civil society, not in the sense that we want to be at the core of the GAP, but that we are worried. We are worried, for example, to see if this GAP and its involvement of civil society leads to a further NGOization of civil society? More concretely, just how does it influence, it also maybe disturb those political processes of civil society negotiating with governments the policies, and what is the role and the influence and the impact of those external actors that through the GAP even get a stronger voice? Next, please. Yeah, so the main focus of our work was in fact on having a close look at how the GAP frames country ownership. And well, you might look at that quote I put in at the top of this slide, and you might like it. And it's nothing wrong if you like it. Language matters, in fact, and too often we see the story of poor health and poverty referred to as one of charity, one of generous donors in the global north, knowing what is good and what needs to be done in the global south. And the GAP itself, it's another such a story of strong global actors in the north coming together and defining how they could do better for improving the health in the global south. But you will not find so easily this kind of neo-colonialist or paternalistic narrative in it. Just the contrary, it's a nice document, it's nicely written. And in particularly throughout the GAP, there is this mantra of country ownership. And this is nothing to oppose. We just had a look at the small print of the GAP and we saw there some tensions and some cracks that might affect the implementation, but also the impact of the GAP, and move it into a direction that would not correspond with its nice overall discourse. So I highlighted on this screen, on this slide, I had 4 of them. So still on the same, please. Yes. So the first question is, who exactly aligns with whom? In the 8 effectiveness languages, alignment means normally alignment of the agencies with country priorities, with country's policies and strategies. In the GAP, alignment stands for alignment of the agencies in support of the countries. It's also expressed as coordination based on a so-called engagement with the countries. And so only the implementation of the GAP will show how this difficult balance between alignment among agencies and alignment of agencies with countries will play out. And this leads to the issue of how country ownership is framed in the ambition of engaging with countries. And that's not so clear about, the GAP is not so clear about country ownership as you might think when you just read the headlines. For example, I give you 2 quotes. I read them from the screen. First one, while country governments will play the primary role in determining national priorities, strategies and implementation approaches, achieving the health-related SDG targets requires a whole of society effort. The second one, although country requests for support under the plan will normally be signaled by governments, demand from civil society, from the private sector and other country stakeholders may also be evident. So you have again here this in a way split narrative of having the governments as main counterpart, but also it has this multi-stakeholder narrative where also the private sector the corporate sector is invited to contribute and to be part of the picture. Third one is, you know, if you say it's the country who leads, if it's the government who leads, then it's quite difficult to be strong on, for example, on rights or on gender or on other normative language, because, well, then it becomes also an issue of diplomacy. And sometimes we see, even if the GAP itself, the plan has quite a strong language on those topics, then we see it in a way diluted or hidden behind quite a diplomatic framing of, well, the countries define what out of the GAP they want to be implemented. So this means that if a country is not so really interested to change anything regarding gender relations, it might disappear from the field of action of the GAP agencies, at least in that country. Finally, and to end here, the GAP calls itself to be a global action plan, you know, but there are other global framework and instruments, and it's not so clear how this is interrelated. And yeah, for example, how those UN agencies who are also involved in the UN development system reform, how they have to react if there is not the same messaging, not the same narrative, not the same plan in the GAP and in the UN development system reform. So let me stop here. Here on the slide, you see the conclusion of our paper. And I think this conclusion is quite still valid. It's all in the making. You know, the GAP is a new instrument. It's really young. So let us give them a little bit of time also to develop a practice around this action plan. And one of the worst things that really could happen if this plan remains just a plan, if it's not implemented. The second bad thing that could happen if it's another one of those well-meant initiatives that finally rather strengthen or increase a power imbalance between those really powerful agencies and the governments. And to conclude, Myria, yes, so let us watch the GAP as civil society. Let us critically look at it right now, only starting now. So this whole input from myself is meant as a teaser. If you think that there are some ingredients that trigger your attention, please join us in watching the GAP. Thank you.
Thank you, Thomas, very much. And thank you also for highlighting basically one also of the objectives of this series of webinars that we decided to do together with the other civil society groups, which is to draw attention of civil society organization to the GAP now that it's June, it's in the first year of implementation, so they can keep an eye on it and use it also as an accountability tool in their country realities, where really it's going to play out whether it has an added value or not. So we mentioned also in the beginning that in September there was the launch of the first progress report of the GAP. We followed the launch online. We didn't hear so much on the content of the progress report in that launch. So for this reason, I think it's going to be very interesting to listen to Isadora coming next, telling us a bit more on this first progress report, what was reported as progress, and any relationships between the GAP implementation and the COVID response. So Isadora, the floor is yours. Thank you very much.
Thank you, Myria. And thank you to all the participants who joined today. So in the next few minutes, I will present the key messages included in the progress report on the Global Action Plan. And as Myria said, it was launched on the 15th of September. It was accompanied by a high-level event chaired by Dr. Tedros, where the principals of the other organizations also joined. And if you're interested, that live event is still on our website and the video is there. Next slide, please. So this is the first progress report on the Global Action Plan, and it presents early evidence of the progress achieved since its launch at the 2019 United Nations General Assembly. It focuses very much on the learning by doing approach, which has been used by the agencies to really try to lay the groundworks for sustainable impact and action. It shows that the agencies have moved from commitment to action. It underlines again that the implementation of the GAP is really grounded in country support, and it aims to build on existing mechanisms and not invent anything new and parallel. The progress report includes 5 country case studies where and highlights how the agencies are coming together in those countries and are working together with the government to align behind and support the national priorities. It shows that working groups have been established for each of the 7 accelerators areas, as well as for the cross-cutting a commitment to gender equality. And it includes some high-level actions which these working groups plan to implement. And specifically, it also includes some actions related to the COVID-19 pandemic and how these working groups have worked to shift their focus slightly in light of the current pandemic. It also shows that the Global Action Plan has really increased mutual understanding and trust between the agencies and has led to the establishment of strong communities of practice, which in some cases did not exist before the GAP. However, it is also honest about the challenges which have been encountered in the first year. And some of the main challenges are actually listed in the progress report. And I will just briefly present them here. So yes, I don't have a slide for that. So these are as follows. First, the need to further incentivize collaboration within the agencies to really institutionalize the GAP at all levels of the organizations and change the ways of working of these organizations. Second, the need to sharpen the accelerator's focus, particularly in light to COVID-19, but also to ensure that there are strong linkages and synergies between the accelerators. Third, the need to better understand how to really optimize the alignment approach among the agencies. Fourth, the need to increase transparency and accountability, which is something, of course, that this progress report aims to do, but it's also something the agencies are really working on at the moment, also in response to the joint evaluability assessment, which the independent evaluation offices of these 12 signatory agencies have led. COVID-19 is recognized as both an opportunity and a challenge. It provides, for example, the opportunity to sharpen the focus of some of the accelerator working groups, but of course it has diverted the attention of many actors in global health in general. And finally, the progress report recognizes the need to strengthen the engagement with civil society. And agencies are exploring opportunities. And I am sure that this series of webinars will help also have a discussion on the engagement. And we will have the opportunity also today to discuss in more details with Melissa and Andy, who are representing the Community and Civil Society Engagement Accelerator Working Group. Next slide, please. So concretely, agencies are working together with countries to identify priorities and start implementing together. Countries have been engaged mainly through 2 accelerators so far, and these are primary healthcare and the sustainable financing for health, but other accelerators are starting to move also towards engaging countries. In this slide, you can see the 5 countries which are included as case studies in the progress report, which are bolded, but as you can see, there are many others who have already been engaged by these 2 accelerators. As I mentioned, the working groups for each of the accelerators and gender equality are up and running. And agencies are also working on their alignment. So in particular, as Hendrik mentioned, an operating model was developed, which is available online. The GAP is being institutionalized within the agencies. We are having discussions also with the UN office who works on the UN reform process to ensure that there is alignment and synergies between these 2. And finally, the agencies are working to account for their progress. And this progress report is a big part of this work. But also, as I mentioned, a joint evaluability assessment was led in the past months, which has resulted in a series of recommendations for the agencies, and which will really help these agencies and pave the way towards the 2023 independent evaluation. Finally, some of the knowledge which has been acquired in this process in the past years has been transferred also to other fields and other SDGs, as for example with the Acceleration Framework for Water and Sanitation, or SDG6. So in short, this was a very brief overview of the key messages of the progress report. And I thank you for your attention, and I'd like to give the floor back to Hendrik if he has anything to add to this presentation. Thank you.
Thank you, Isadora. Hendrik, if you have something to add on the progress report, and you can do it in a minute, that would be great.
Yeah, nothing to add, and I think we go to the questions and then take it from there.
Okay, in that case, I would like to give the floor to Thomas to actually share a few thoughts on the progress report now, and this will also open the open conversation that we will have afterwards with every one of you in the audience. So Thomas, over to you.
Thanks. I will just drop some bullet points, and I see myself here as initial speaker. I hope that others will join, giving their assessments on the GAP and its initial implementation and impact. So the first bullet point is the same as before. The GAP is a young instrument. If you look at this quote, it's quite nicely framed, from doing to learning. So, the GAP has been developed in a rush by demand of some important member states and now it's there, and now it's implemented, and now the agencies are learning. And one of the things they need to learn is about monitoring and evaluation and transparency. We still need quite a bit of transparency. We don't have, for example, public lists of GAP Sherpas, of those working group coordinators, of country focal points. But we are quite happy that we have this first report, and we hope that we get more of this kind of instruments that only allow us to look at its implementation at global level. But be aware, there is a challenge also of watching the GAP implementation at the national level if you don't have the information. Second one, cultural shift needed. I think that's an interesting one. And it's really something we like to watch closely. Whose culture will win? Is it the culture of doing kind of development business with all kind of actors involved? Is it also a culture of collaborating with each other? As this is such a diverse group with really so different institutions and so different cultures themselves, for example, regarding their engagement with civil society. Next one. Yeah. From the country engagement narrative, can say, okay, we had only a few countries who wanted to engage with us initially. So this is clear that we can only report on progress in a few countries and on those two accelerators of primary healthcare and sustainable financing. This suits perfectly well with this kind of country drive. You can also say it's an excuse for a slow start, but we also know that times are harsh, so in times of COVID-19, it's not so easy to get into making such a plan alive. Next one. Yeah, we will look at in details about those two accelerators or focal topics. The first one, sustainable health financing, with the agencies who are in the driver's seat of this, with the being the usual suspects. So it's the Global Fund, it's the Gavi, it's World Bank, it's GFF. The question is if the stories that are presented in the report are also mainly business as usual, or just presented in a new way, or if there is really a new quality, if the GAP on financing makes in fact a difference at country level. We need to ask our country level colleagues for providing the answers. So this is why we need to give this much more space. What I see is a kind of a returning back to what has been promoted as a sector-wide approach or basket funding, where donors align themselves and get countries on board on particular packages, particular approaches. In a way, it's clever for those countries who engage. They can refer to this global action plan. They have a new language on reaching out to those donors, but it's quite difficult to see, is this now a donor-driven new solution on to old questions, on the old issues, or is there exactly a new way also for countries playing a role? And the same if you go to the next slide with primary healthcare. We see the same play happening. We see countries really keen to engage, because the way the primary healthcare is framed here as primary level care, as essential health services, is quite attractive for some countries to engage. Which we also see the same misconception of primary healthcare. The whole political element, the whole element of addressing the root causes, putting communities and people right into the center of a health system, and working on really advancing global solidarity is in a way lost in translation. But this is not only a problem of the GAP, this is the current state of talking about primary healthcare. And finally, next. So there are those blind spots, and civil society is one of those, and we will discuss about it. Determinants of health is also one of those blind spots, and I'm happy that some people in the team could talk about, is this really just neglected because it's so difficult, or what's the problem with those agencies pushing for addressing political, social, economic, commercial determinants of health? Next. Yeah, I talked about COVID already. I think it's also an additional strong push for those organizations to really better cooperate. And the conclusion is the same, and that's the next slide. Also, it's worth reading this progress report. Really, it's a long document. The country stories are quite strong. So look at them and think about them and engage. Thank you.
Thank you, Thomas. And you will have seen already that in the chat we have shared many links with the material, the GAP, the progress report, our analytical paper from civil society, so you can have a look at it. I would like now to open the floor to some to some dialogue. So please feel free to raise your hand, and then we're going to unmute you. You can raise your question. I already saw a very interesting question in the chat from Ravi. So Ravi, would you like to raise your question, or I can also read it from the chat?
You might do so.
I think, yeah, okay, I will read it from the chat. So the GAP recalls the earlier IHP Plus with principles of country ownership, harmonization, alignment, and mutual accountability. In that multi-year effort, country compacts were developed to guide the work among low and middle-income countries and donors. The end result was that countries largely lived up to their commitments, but donors found it too difficult to change, especially on a country-by-country basis. So, and I think the question comes here, with a GAP comprising many of the same donors as were once in the IHP Plus, what do these donors plan to do differently within their own operations, or is this just recycling the past IHP Plus, this time without the LMICs in the main table? And I think this brings back also what Thomas was discussing before, is this just another new plan, or what difference is going to bring? So if anyone from the group would like to comment on that and reflect on that, please go ahead.
Thanks. Shall we start replying now? I thought we get a few more questions. Yeah, I think it's a very important point, and Peter Singer also replied already in the chat to that. Indeed, we are studying the experience with IHP Plus to really understand the strengths and the weaknesses, and to learn from weaknesses and past failures. And I think really there are few key issues which we see from this assessment coming out. So it's clearly the issue of country engagement and country leadership. When you look at IHP Plus and some of the countries which were successful, you had very strong leadership and you had agencies come together in a more aligned way. And when Ethiopia, Rwanda are often mentioned as some of the countries. And of course, for us in WHO, as Dr. Delos led a lot of this as Minister of Health, he also reminds all the organization always of this importance of this leadership. And so we're trying to understand and in a way see how we can, or how this can be replicated in other countries which maybe don't have yet as strong leadership systems in place. The other element is this institutionalization in the organizations. And I think the principles meetings which we have is an important point there, because it keeps it high on the agenda of the organization. I think with IHP Plus, what we've seen so far, it started, of course, with very strong engagement, but over time it became more and more a technical thing, somewhere nested in the organization, but sort of the overall leadership was not there anymore. It was more sort of a project you deliver than sort of a way of working. But we're looking into that, and in a way institutionalizing, changing the practices, how the organizations collaborate, takes time and is difficult. And many of these decisions depend on the boards, the governing structures of these organizations. And I think that's also to keep in mind that the Global Action Plan was not in a way endorsed by a single governing body of these agencies. It's a self-commitment of these agencies, and it needs constant work to make it happen. And then the last piece is really the incentives which are key, and I think we can learn that from IHP Plus, and there are two sides of it, no? The push and the pull incentive. So one is really countries and civil society as one of the actors there, demanding a closer collaboration, that not sort of each agency pursues its own program, but there's pressure from country level to bring their support together. But then at the same time, sort of on the push incentives, whether it's the boards, the member states on the boards, or sometimes the civil society members on the board, but also the donors, how they provide their funds, that they incentivize collaboration.
Thank you. No, thank you, Hendrik, for this. I would like to call Eli Baggio to unmute himself, introduce himself, and share his thought or his question. And then I will call on Derek Nzibirwa from Seale to do the same. Eli, the floor is yours.
Thank you for this.
Can you speak closer to your microphone because we cannot hear you?
Say that, do you hear me?
That's better.
Okay, thank you. I say I am Eli Baggio. Eli Baggio, I am from DRC, the Democratic Republic of Congo. I am the director of a platform. Please, you listen my English. I'm not good in English. I'm in French country. I am the leader, the director of the COPASAH. In French, we call it Conseil sur la santé et l'Académie de médecine. We call it, in English, you can say that it is a Medicine Academy and Health Council. Again, I am a coordinator in IEDA, IEDA Relief. It is an organization of Africa. It is in DRC, it is in Cameroon, in Benin. In Africa, I am the coordinator of health, health service in DRC, near Mission. Now, I would like to share something about this global action plan. I'm very happy to hear that. Again, I'm very happy to be a member of this plan to represent my country, DRC. Unfortunately, I'd like to say to members of that committee of this platform that in DRC we don't have that those agencies. Don't have those agencies. I've seen in the one presentation they told us about Mali, Cameroon, but DRC is not represented. But DRC is one of countries where we have many emergencies in health and in other problems. As we have just make one group of civil society, of civil societies, of organizations. We have young in that platform. We have also many associations of human, of girls that would like us also to join even a region agency. I see as of Kampala, they are active in that kind of this platform. I would like to join it so that them also should tell us how we can be also better to save our community in that, so that we may be in that universal health coverage, as we are looking for it, all of us together. That's what I'd like to share. In our vision, we'd like also in the coming year to be all of us together, all organizations, so that we may organize one forum, a forum of all organizations of DRC, so that we may deal together. We'll take only organizations which is not of state, not of government. We'll take also only those organizations of I can say donc de la société civile, si je peux le dire. And now we'll do that at the forum where we'll deal how a Congolese himself can deal, can make action to bring solution to his problem. We know that we will not find finish dans le financement. That's what we will not find in the past meeting with the director of World Health Organization. I asked even that question about financement of organizations which is in society. We don't have financiation, but we make ourselves our better to do that, so that us also we may go ahead, because we are determined to do that. Thank you for that speech. I'm there to listen to you.
Thank you, Eli. Thank you for sharing your experience from DRC. Derek Nzibirwa from Seale from Uganda. Please share your thoughts in 1-2 minutes if possible. Thank you.
Yes, thank you very much, the host, Myria, and all the panelists, especially Thomas. Derek Nzibirwa from Center for Health, Human Rights and Development in Uganda, as part of the group that analyzed the gap. And to re-echo Thomas's submissions, I think it is welcome for these agencies to collaborate and align, but whose culture is going to supersede? Are we going to look at the World Bank dictating all these things? Because you look at, they are looking at aligning with governments, but these governments still don't have the structures in the health systems to bring down all whatever lessons they have learned as agencies to trickle down to our health system and make it better. Which brings me to primary health care. We all know how important it is, primary health care, but it deeply depends on the social determinants of health. If they can't define how they are going to address those, as Thomas has said, and yet they have it as part of its, as part of the themes they are looking to accelerate, I think this has been done in haste, as they have also admitted in the report that the CSO engagement has been very lacking, as very many CSOs don't even know about the GAP here in Uganda. It only took a small group of CSOs with the initiation of Thomas and MMI to bring to light this new alignment of these 12 agencies that have a very strong arm in global health financing. So was it done with haste? Wouldn't it have been done better? And the report is already outlining the positive outcomes, but can we really say these outcomes are due to the GAP or they are from other initiatives? I don't know how the assessment was done, but these are very pertinent questions because it still comes down to what mode of operation or what culture is going to come out on top amongst those 12 agencies. Alignment, it's all rosy language, but we know how it is when you bring very many people to the table, and especially such agencies with different mandates, different objectives, and different ways of working. So they need to really go out and operationalize this and put it to the test before they can send us a rosy report like this. That's my submission. Thank you.
Thank you, Derek. I think it was very important to share that, especially when it comes to attribution of results. We will come back to the discussion later on. So I would like to start now the second part of this webinar, because as we said in the beginning, in this series, we will focus in different accelerators. And today we would like to focus on the accelerator on civil society engagement and community engagement. And another webinar will follow for the Sustainable Financing for Health Accelerator, and then for primary healthcare, where we will zoom in more on these accelerators. So I would like to invite Melissa and Andy from UNAIDS and WHO respectively, who are also in the working group of the Civil Society Engagement Accelerator of the GAP, to share how this was framed in the GAP, how civil society was framed in the accelerator, and how it was reported in the report, and what did we learn. So over to you guys.
Thank you, Myria, and thank you for sharing the slides. It's great to be with everybody. So I will share some reflections on we've just got a few slides, so I'll kick off and then Melissa will help us wrap up. If we could move to the next slide. So just a little bit about, first of all, thanks for great contributions. I think we've touched on so many really valuable issues that resonate very well with our working group. I think, certainly all of the issues around, how do we define and understand country ownership and the power dynamics that are involved in that. And then the critical issues around measuring our work and impact and understanding attribution. I think a lot of those tensions have been with us from the beginning, and at each level of the GAP, we continue to work around those issues. What you see on the screen now is a bit of a vision statement for our working group. And I should say that in addition to Melissa and myself, I'm delighted to see that Julianne Birungi and from UNICEF and Kate Thompson from the Global Fund, who are also part of our working group, are also online. So great that they could also join. So you can read on the screen the vision statement really for our working group. So I won't read it line by line, and I'm sure the slides will be shared with all afterwards. Move on to the next slide, please. Thank you, Myria. So our working group doesn't include all of the signatory agencies, but most of them. And you'll see that we've got UNICEF and Global Fund, as I've just mentioned, also Gavi, GFF, UNDP, UNICEF, UNFPA, UNITAID, and ILO, as well as WHO and UNAIDS. ILO has recently joined, or is recently joining, in the preparation of joining the initiative. Throughout 2019, we also had civil society representatives on the working group, which was really helpful. So you see them listed here: Save the Children, World Vision, Impact, Stop AIDS UK, GFAN and Frontline AIDS. And there were others as well that came in and out for specific issues. And we also had close engagement with the CSIM advisory group, with Loyce and others through last year. I have to say this year, we haven't been as organized and systematic in our engagement. So the working group has been meeting, But because we were really focused on getting our work plan organized and really doing some in-house work amongst ourselves, we've kept the working group to the signatory agencies for much of the year, but we're planning now to open it up again to civil society colleagues. And if we can move to the next slide. This is a little bit about what we've decided to focus on. This is also described in the progress report, so I'm not again going to go line by line through this, but just to highlight that we do have a work plan that was developed with civil society input last year. And then obviously COVID-19 has taken over a lot of our focus for this year. And many of us who are involved in the working group have also become extremely engaged in initiatives like the Accelerator. And so, you know, we've seen, again, going back to the other questions, how can we attribute what's being facilitated through the GAP with other initiatives? And I think there is so much, you know, synergy and overlap happening. I think one of our key challenges is to, you know, make sure that the GAP is providing that umbrella focus so that we're actually doing that work to monitor, analyze and promote collaboration, including through those other initiatives. It's critical. So, you know, we've heard IHP mentioned. We work very closely with UHC 2030, which of course is an evolution of IHP Plus. And that's very much part of how we continue to work, gain our energy and insights as well moving forward. So we've also completed a mapping of signatory agencies' engagement in policies and practices and resources around engagement. And I'll say something more about this shortly. Again, you can see some of the areas that we're looking at for both the general work and the COVID-19 related work presented here on the slide. Myria, can we go to the next slide? So the headline really from my perspective is that we've had, I think at global level, we had quite strong engagement in late 2018 and 2019, both facilitated through the signatory agencies, WHO and UNAIDS providing much of the coordination there, but not entirely, but also a lot of organization through communities and civil society groups themselves, including all of you hosting today. And the civil society engagement mechanism of UHC 2030 as well. And there are just a few examples of how that engagement was organized during that phase. Next slide. And then this is the final slide that I will speak to before handing over to Melissa. Really, again, some lessons learned, some challenges and some next steps. For me, I think one of the things that's been, you know, fantastic, and it's quite difficult to measure and to report on, is this idea that we've built this community of practice, this network of people doing the work that I do, that Kate does, that Julianne does, that Melissa does, in our respective agencies. We're having regular conversations now, we're comparing notes, we're on WhatsApp groups. That is really, really helpful. And I tell you, it can't be underestimated. But how we report on the tangible impact of that is tricky. It's really difficult for us. But I found it tremendously interesting. Kate and I were both on a UNAIDS-led process on Friday to really help the UNAIDS Programme Coordinating Board understand and define community-based and community-led initiatives, for example. And we drew on the GAP experiences as part of that conversation. So the member states involved in that conversation were interested to hear not only what was happening in HIV, but what was happening in the broader health sphere, including through the facilitated process of the GAP. So, you know, there's day-to-day stuff happening around this all of the time, which we just don't have time to document and share constantly. As I said earlier, I think, you know, it's critical that we continue to amplify, identify and encourage best practice. But again, we have to avoid duplication. The whole point of the GAP is to add this value, to collaborate, to iron out where there are areas potentially of duplication, and also better align, you know, if the funding agencies and the UN agencies, which in broad crude terms are the two camps, if you will, of types of organization that have come together around this initiative, if they've got slightly different approaches, how can we work better towards getting common ground and agendas? And I think, again, that definitions piece UNAIDS is doing is really an important example of that. The other thing that we've struggled with somewhat is maintaining
just try to wrap up because we don't have a lot of time.
It's a street focus for our work stream while also mainstreaming across the GAP. And I think we've heard others talk about this, including from a governance perspective. We've had some staff turnover. We had 2 very active people from UNAIDS, Kent and Letitia, who have moved on. Fantastic. We now have Melissa and Efrain Gomez engaging with us. And we do plan to reintroduce civil society people and community reps onto our working group. So let me pass to Melissa for the final slide. Thank you.
Melissa, if you can conclude the presentation in a minute, so we have time for discussion as well.
Sure. I think, thank you, Andy. I think what we want to conclude on is what do we want to achieve by 2023? And I know that collectively we all want the same thing. And I know that we are learning from the past and we're using what we have learned to really plan for the future. So we want stronger civil society engagement. We want stronger community engagement in and across the GAP signatory agencies. But we also want to support meaningful civil society engagement at global level as well as country level, and ensuring that they have enough resources to support these processes. And we want to see health impacts and results demonstrated the added value of civil society and community engagement. I was really pleased to hear from the countries that shared their experiences earlier, and I know that we can be optimistic and look forward to a better civil society and community engagement on the GAP, but I would extend it to health and ensuring that we have community engagement in national health planning processes. So wrapping up, thank you.
Thank you, Melissa. So speaking of civil society engagement, so I would like to give the floor, Roy, to you now, but if possible, just keep it in 1 minute. If you can tell us how the determinant of health accelerator on which you are working on, how and whether you have managed to link this with the community and civil society engagement accelerator. And then I would like to allow more time for our colleagues from CSOs to provide inputs. So Roy, very, very briefly, if you can.
Yeah, no, it's a simple answer in 1 minute. So just, I think I'll start by reiterating a great point that Thomas made about how, you know, in many ways, if we just go by country demand and country perspective, we might lose some of these difficult to address contentious areas, such as determinants, such as gender inclusion and rights. And I'm thinking of the Lancet paper that just came out looking at global burden of disease, and we have air pollution, we have you know, high blood glucose, we have all of these things that are on commercial determinants of health. And how many countries are jumping up and down saying, let's address commercial determinants of health, particularly in the context of COVID? So our task right now is recognizing that actually COVID is highlighting the importance of addressing determinants more than ever. It's providing in many ways a guide to do that through countries' COVID-19 response and recovery plans. And our strategic focus with the GAP now is to take advantage of that opportunity to bridge these sort of immediate responses to COVID with this sort of longer term thinking on addressing determinants of health and restoring progress on the SDGs. And that's the focus of our efforts right now, using countries' COVID-19 response and recovery plans as a guide. We're doing an analysis of those plans, including to see how they address equity and determinants, and as part of that, civil society engagement. How is civil society discussed in these plans, and in what capacity? Advisory capacity, policy development capacities, you know, what are the engagement strategies? And we want to use that to sort of create demand and respond to countries' needs at the same time. So I'll stop there.
Thank you. Thank you very much. So I would like now to invite civil society colleagues to participate here. And that's the moment where I'm going to remove my moderator hat and put on my global health advocate hat on behalf of Wemos to share what was our experience at global level in engaging with the GAP and what challenges we encountered. So I'm going to be very brief. We started looking and monitoring into the development of the GAP from the very beginning, since October 2018, and then the beginning on 2019, we really saw a gap in the GAP, let's say, when it comes to human resources for health. which is something that we are focusing our advocacy work on. So we raised that in different panel discussions of the G2H2 network. We also raised that in an event around the World Health Assembly in 2019, and with the WHO Health Workforce Department head, Jim Kimball. So we saw the need there. We were asking for participation in the development of the GAP, but we really thought that this came very late because the online public consultation process opened in June on the first draft papers of some accelerators and not a full draft. So yes, we participated on that, and then we were really reaching out to see, okay, what is happening with the development? How did the input was taken on board? And then we saw just 2 weeks before the launch that all the input of non-state stakeholders was published, just plain as they were submitted in the form without analysis. And then we saw a report of this input, an aggregated one, I think a couple of days before the launch. So we didn't really see how the input really of civil society was taken on board until the very last moment. So that was in the development of the GAP that we saw some drawbacks there, and that's from the global level. But I would like to ask now Aminu from COPASAH to share what was his experience from a national level perspective in civil society engagement. Aminu, over to you for a couple of minutes.
Okay, thank you, Myria, and thank you, distinguished panelists and our wonderful participants and all our key speakers from WHO, UNDP, and UNAIDS, the secretariats of the GAP. So I think we don't have a lot of time, but and so I'm not going to discuss what majority have already talked about. So it just to add a little more points in the area of the country conversation and perspective around the GAP consultation. But it's not only about the GAP consultation we are discussing, but also civil society and community engagement with respect to implementation of the GAP at country level. So I think we have spent 1 year now. We need to move from consultation and engaging CSO and community in implementation of the GAP. And we hope that the Secretariat that are here, you have listened to everybody, and you have mentioned some challenges also, which we would like to commend you for that honesty. Isadora has mentioned about the GAP has faced number of challenges in implementation, and also Andy has mentioned that the civil society engagement wasn't that too strong, but you look forward to engaging with CSO and community. That's, to me, I think is a good step to move into the last part of the 2020 and the 2021. So I think it's important for us to define the community. Who are the community? The community engagement we have been discussing at the global level is different when we say community engagement, and at the country level it's also different. It's not the same. So these are terms that we use differently. At the global level, when we mention community engagement, we are referring to those global networks that have communities. Like, for example, a Stop Aid is a community of different civil society organizations engaging in HIV. You can have GFAN. It could be defined as a community because it's bringing civil society groups to discuss tuberculosis and other issues around global fund. That is a global understanding of community. When you come to country level, it's a different ballgame. The community we are trying to see is not only the global civil society networks and those privileged NGOs at the country level who are opportune to attend global meetings. So like me now, I'm in Nigeria within the national space, but sometimes I'm privileged to attend global meetings. we are the usual suspect, and many of us all the time, well, you are seeing our faces. So at country level, we are looking at those communities who are not opportune to attend global and international meetings. Health professional bodies, the groups that are organized around patients' rights and care, the group around treatment access, those grassroots and subnational level community NGOs who will not even have chance to even travel, to even national meeting, not to talk of going to global meeting. These are the community we are referring at country level, and we hope as you make your annual plan, you need to begin to look at all these different categories. The national NGOs also, as we are aware, they are only opportunity to join the online consultation. Many of them were not opportune to be at the New York during the high-level meeting around the USC and the GAP. So these are also category of groups that we hope that we need to engage as we move into the 2021 work plan. And we also had from the Secretariat, you mentioned there's a 2019 civil society working group. You gave some good example of Save the Children, the World Vision, the Impact, Stop AIDS, GFAN, and the Frontline AIDS. And we also have on another side, the civil society advisory group of the GAP, which is being led by Loyce and Justin, our good friends. So these are confusion. We need to connect the two. So as we move into 2021, I would like to appeal to the Secretariat. We need to join these two conversations. So there will not be a parallel conversation of engaging CSO working group differently, at the same time engaging the GAP advisory working advisory group of CSO differently. We need to find a way of bringing these two different constituencies together to make a meaning as you move to implement some of these issues. So we hope that this is something that, from our experience of last year, we can build improvement from what we are saying now. The last one I also want to mention is the GAP partners at country level. For example, WHO, UNICEF, United Nations Women, you have the Gavi, GFF, and the Global Fund. They all have offices at national level, and some of them, if they don't have offices, they have liaison officers who are working through different mechanisms, like the country coordination mechanism, the GFF liaison officer, the WHO office. We hope that these partners can identify the real country CSO at country level, not the not the international group again, because we're engaging the international NGO at global level. When we come to country level, let us go down the ladder and engage national CSOs, so that these global partners that sign the GAP, they will hear from the community grassroots NGOs, and they will also hear from the national NGOs, apart from listening to the international group, who are privileged because they have financial resources and they have the wherewithal to participate in all these activities. So these are some of the country perspective, which we are making a passionate appeal to the GAP partners that let's improve this engagement. We appreciate what you are doing. We commend you for launching the annual progress report, which many country CSO only had about the global report already after publication. But it's a step forward, and it's also a progress that you have made. But we hope that the next 12 months we'll see definition of engagement, more defined, more rigorous, more engaging, more cohesive, and more coordinated at country level. And we are always around to support you and to give you advice where necessary. So let me stop here, because I know, Myria, you're running out of time, and we can come back next week to look at more discussion around the primary healthcare and the financial accelerator. Thank you very much.
Thank you, Aminu. So I would like now to ask Loyce, because we hear from my side, from the global level, we hear from Aminu from the national level, but I would like to ask Loyce to come in very briefly to tell us how was it to engage with the GAP from the inside as the official group that was engaging with the GAP. Loyce, over to you.
Well, I think with your permission and given where we are with time, I really want to hone in on maybe some recommendations that we did make as advisory committee members, advisory group members, because Aminu and others have already done so well to recount some of the history. I'll just point people to two things before then. There are some references that Thomas and I put into the chat box for background on who the advisory group is and how that came together, as well as a couple of asks that we made, several asks I would say we made of the Secretariat and of the Sherpas, as well as the principals in the past year. I'll also highlight something I think Andy and others have been honest about, which has been this idea of the consistency of our engagement or inclusion or lack thereof. And it's not a matter of principles. I think we all agree, including and especially the Secretariat and staff, that civil society, like advisory group members, should and beyond should be engaged, but the practice has been where there's a challenge as outlined already. And so from our standpoint, what we've asked for and what we still would like to see is this idea of how best we align what exists across civil society and what is still missing or who is still missing when we engage civil society and beyond just the NGOs, as people have said, but also these community groups. We already know that these networks exist and each of the agencies are tapping these types of networks, but how we all come together and how we're building on those existing structures and engagement models is still very much an open question mark, I think, for a lot of us, including those of us in the civil society space, but even some of our intergovernmental colleagues online. We also have really been pushing for funding, resources, and other essential components to support that engagement. And I don't think it's come up yet here today, but that's a huge missing link. You know, not only is it a matter of access, but it's a matter of not having those resources for these champions, particularly at the community level. And we still don't know if and how that can come about through the GAP, but we're hopeful with additional resources for COVID that can somehow translate to resources for this critical civil society and community engagement. The last thing that I'll point to, which continues to come up for us, aside from all of the evaluation and other pieces we all want, is this very basic question of entry points. How on earth do people really know where to come into this? And this has been a question that I've even seen as part of this discussion. We as advisory group members have proposed a couple of ideas with regards to how that could be organized. And for our part, we are very much in favor of getting away from this global approach to a national or community approach. And we very much want this advisory group to be less global and more focused and based at the country and community level. But we also want to be sure that's not just set up in name without having some clear parameters for people to come in, because we know that there are limited time and resources at the local level for people to really navigate something that might ultimately be confusing. So that's still very much a missing link. Again, not for lack of interest by all parties, but it still requires some very real practical steps. But with that, I will stop there. Hopefully that brief review or overview of kind of where we stand and come into this is helpful, but I'm very interested in hearing more from everyone who's joined us today. Thank you.
Thank you, Loyce. And we were already on time, but I would like to extend the time of the webinar for a few minutes so we can get more input. Thank you for all this. And it's like a call for CSOs to reach out and engage with the GAP, and we provide many links on the chat on how to. So I have two raised hands. Lizzie, please, Lizzie Ikpine from Nigeria, please unmute yourself and share your thoughts with us in a minute. Lizzie, can you unmute yourself? And then you take the floor. Okay, we had, maybe Liz has some trouble with the sound. I think we had someone someone else. Ibrahim, if you can hear us now, you can unmute yourself and share your thoughts with us.
Yeah, thank you for giving me the opportunity. I want to thank all of you. I'm not too familiar with what the GAP initiative is all about. Unfortunately, I joined this webinar late because we're giving the wrong time. But I want to assume that based on some of the discussions I've listened to, that when you talk about GAP, it's more of the gaps in the various elements of health systems, human resources, finance, and so on and so forth. I also want the initiative to look into the gap between government priorities and the priorities of development partners, because sometimes they are variance with what is relevant for that country. So as CSOs, I want people to look critically about government priorities at any point in time and the priorities of development partners that are supporting a particular country in that. So that is my contribution.
Thank you. Thank you very much. Let me see. If anyone wants to add anything, just please raise your hand. Lizzie, let's try again with your sound. No, Lizzie, if you can unmute yourself. No, I think we have some sound problems. Anyway, so we are already over time. So I would like to thank everyone for participating. I think that was a great opportunity to share more on the GAP, to discuss more on the civil society engagement and the community engagement with the GAP. This is really a call for civil society as well at the national and global level to put the GAP in their agendas, because it's going to we can make it a very useful tool actually for moving forward the development aid beyond aid if we want to. So please follow the links that we shared. And it really comes from the countries, the call for engagement with the GAP, as we learned from the progress report as well. So with that, I would like to close, and I would like to invite everyone on the next webinar that's going to take place next Monday, same time, is going to focus on the sustainable financing for health. Accelerator, we already have a confirmed panelist from the GFF that is going to share her experience by leading the Sustainable Financing for Health Accelerator, by being in the working group. And again, of course, colleagues from civil society sharing experiences from global and national level. So you are all welcome to join. And with that, I would like to thank you all. The recording is going to be available in the page of the Kampala Initiative, who was our technical host for today. So thank you very much for this.
And the GAP assessment report.
Sorry? The GAP assessment report is also available, and the link was shared in the chat. So thank you all for being here, and I hope to see many of you next week and engage in more discussions on the GAP. Have a nice day. Have a nice evening wherever you are.
Thank you.